Hello everyone, welcome to my channel. It's Rafael Gutierrez, and today I'm going to talk about pain and what it really means when you're training. Now, a lot of people have actually the idea that came sometime before the 80s, which it's no pain, no gain. If you're not hurting after training, you're just not training hard enough. And one of the big things that I tell people is you really have to understand what things mean to the body. For instance, one of the big things to remember is that there are actually a lot of different types of receptors. And there's a lot of different types of receptors. And one of the things with these receptors is that they are actually looking at different things. So, for instance, one of the ones I'm not going to talk about is called the photoreceptor. These are the ones you're using right now. It's actually for vision. And you do use them for training, but it usually doesn't tell you what your body is doing unless you're bleeding somewhere. You then also have mechanoreceptors. Mechanoreceptors, just like they sound, they actually see what is happening mechanically in the body. They look at pressure, they look at movement, they look at stretch, and they take this information and send it to the brain, and that goes to the rest of the body, and it ends up getting the body to react a certain way. Besides these mechanoreceptors, you also have chemoreceptors. Again, these are actually really important when you're training because these are the ones that are going to tell you if your oxygen levels are right. They're going to tell you if your blood glucose levels are at the right level. They're going to tell you if your carbon dioxide levels are too high and you need to breathe more, if you need to take a break. These receptors tell you pretty much the chemical stuff happening within your body. And they are, like I said, they are important for training. The other ones that are actually also, all of them are important, obviously, but the other ones that are really important when we're dealing with training are actually pain receptors. And there are different types of pain receptors. Some are for sharp pain, dull pain. And those are the ones I'm going to actually talk about because one of the things you'll notice is you do have mechanical receptors, which tell you if there's stress on the body. And then you have pain receptors, which tell you if tissue is damaged. Now, there's a big difference between stress on the body and tissue damage. Stress on the body triggers cells to make that part of the body stronger. It makes it so your body can heal itself quicker so you can recover. Pain receptors are all they're telling you is that there's damage to your body. If something is hurting, that's telling you there's damage. And depending on the amount of damage that happens, it means that the body will take longer to recover. Now, one thing to actually look at when you are dealing with these receptors and how things actually work is to look at different laws. Now, one of the interesting laws that when it comes to healing and working out is called Wolff's Law. Wolff's Law pretty much says that tissues, now there's technically, if you go and look at the lecture I have on tissues, you'll notice that there are 4 basic classes of tissues, and then you have thousands of other tissues on top of that. Now, tissues will react to stress by making themselves better for dealing for that stress. For instance, in bones, which is where Wolff's Law comes in. If you constantly have weight bearing on bones, the bones will get stronger. Now, here's a big important thing. The pressure on the bones from the weights, the way you're using the bone will cause the bone to actually change shape to be able to be stronger. If it breaks, you now have to heal the bone before it gets stronger. Two different things. Some people, like I said, I actually read people who say, well, no pain, no gain. Look at my knuckles, I tore skin. Well, congratulations, you did tissue damage and you're not building yourself up. By the way, like I tell people, I do makiwara. I usually don't tear my skin unless I do something really stupid. But try to avoid that. Learn from my mistakes. Try to avoid doing dumb things. So the big thing is this. You have pressure, you have pain. Pressure is good. Pain is telling you stop. If you want to actually see how this is done, how this is actually seen most likely, think of a time that you may have needed stitches. They give you lidocaine. Lidocaine tends to numb certain types of receptors, namely pain. And so sometimes when they're stitching you, you can feel the tugging and pulling, the vibrations from the mechanoreceptors, but you don't feel the pain. Now, I actually decided I wanted to look at how professionals tell people how to get better, how to get to begin at a new event. And I actually decided to look at an event that I think is the hardest ones to prepare. Probably because I've never done this before, but it's still something that I think this is going to be something that would be killer. What I looked at is how people who actually study marathons teach people to run marathons. Interesting thing I found. I actually found a lot of articles where they said that the average American can learn to run a marathon in 6 months. Now, this isn't saying you're going to win the marathon. Doesn't mean they're not even saying you're going to place. It's just you're going to start and you're going to finish 6 months. Now, to me, a lot of people say, well, this sounds really fast. But the thing that for me, I actually think about it is we're going from the average American walking about 2 miles to a marathon going for 23 miles. That's almost a 13 point difference, 11 point difference. What is it? It's 2 miles and it's 23 miles. So yeah, so it's about 12 times the distance. And so the big thing that ends up happening with this is it's not a overnight thing. Actually, what's funny is they said that in a month you might be able to do a 5-kilometer run. I don't know if I would be able to, but I would actually consider trying. Now, there is actually a lot of different things that they do actually tell you if you are preparing for a marathon. One of the big things that they tell you is to know that you're not doing it overnight. You're not going to say tomorrow, hey, I'm running a marathon tomorrow and we'll see how that goes. You're going to take time to do this. 6 months is what they're actually saying, minimum or average. The other thing they actually say is make sure you have the right equipment. Now, I'm going to tell you, if you're training karate, you need the right equipment so you don't get hurt. You need the right type of makiwara or the right punching bag. You need to know the techniques to do it properly. It's not just hey, I'm just going to wail on a concrete wall and hope something goes right. With marathons, they tell you, get the right equipment, get the right shoes. Sometimes you may need some, read one site that says if you're overweight, you may need some pretty much special cream to avoid chafing. So they actually say, look for get the equipment that you're going to need. Next thing that I ended up reading, and I have my notes on here, so that's why you see me jumping on. One of the other things that they tell you to look at is to make sure that you have, besides the right equipment, make sure that you cross-train. What they actually say is rest and cross-train. Make sure that you have a time you run, some time to rest, another day you might run, and then you cross-train afterwards. And what they mean by cross-train is do any type of exercise that is not running. They also, by the way, say don't do any contact-type sports. This is mostly to avoid injuries. And so that's one of the really neat things is professionals who actually teach people to run marathons, tell people, make sure you have rest and you don't do the same exercise every day. Give your body time to heal. Another important thing that they mentioned is to keep motivated. Remember, this is not something that you're going to do today and be able to do it tomorrow. This is something that takes at least 6 months, so you have to build up gradually. To me, to be honest, I see the 6 months as relatively fast when you think of, going from 2 miles a day to 23 miles a day, 23 miles. It's a big jump. And so that's actually one of the big things that they talk about. It's going to be a gradual process. Don't get discouraged. Try to keep motivated. The other interesting thing that I've actually noticed, and this happens in every professional sport, like I said, actors who are training will actually do this. They get dietitians. They get people who have actually studied the biochemistry of food and develop meal plans so they have the proper vitamins and minerals, the proper combination of foods to get the maximum benefit from what they eat. This actually would include getting the right fuels and actually healing. A lot of times there's people like me who think, wow, wouldn't it be great to eat just a pound of bacon? Well, if you're trying to actually get better at a physical activity, having that pound of bacon isn't going to be practical or logical, because you need certain things to help your body heal. And there's a lot of stuff in your body that needs certain types of calories to actually function right. Now, like I said, starting Tuesday, I am going to try to get to be able to run 5Ks. Don't really do much running myself. And so I'm hoping that this works out. I will let you guys know after every run. Hopefully I'll lose a little bit of the Christmas fat, and I will start continuing this. And I am going to talk more about receptors, especially pain and damage that occurs, because I have gotten a couple questions on why certain types of training may injure the body. I hope you enjoy this. I hope you train smart, and I hope that you have time to see if what I say makes sense. Look to professionals who are actually studying this as well, and see if this is something that you can bring into your own training. Hope you enjoy this, and have a nice day. What do you think?